These are not pharmaceutical interventions. These are straight interventions. I wasn't sure what to call this talk, so I said maybe I should just explain what I've been doing lately. And it's a complicated world out there. We have all sorts of venues. Some are desirable, some aren't. Subways are so-so. We're not excited to ride on them, but we can't wait to get back into museums and restaurants and theater. And when you look at all the combinations, I started writing all these different venues and some of the ones that I sort of deal with. It's a wide array, and because you're in the biggest city, the best city, the most exciting city practically in the world, it's very frustrating. When can I go back into some of this? And we know all the usual interventions. Some of these will need face masks, some we social distance, some we totally avoid, like the subways. There are many people that just don't ride subways, period. So that's not social distancing, that's complete isolation. We also have a variety of hygiene and disinfection products. There's always another mousetrap that's being invented, and I'm being contacted saying, well, does this work? Can it work? Can it work here or there? So it is a crazy world. And of course, most recently now with the reopening of schools, people are becoming indoor air quality specialists and answering the question, what my windows don't open and where do I get fresh air and how many air changes per hour are necessary. So it's putting a big stress in our field with all these topics. And where do these boxes intermingle? At what point do we use all of these for one venue versus being at home, in which case you're not using any of them? So some of the observations in the past, we have foggers. People are putting disinfectants in foggers, hoping to release material and get a deposition. So you have sort of a long-term disinfection quality. It's not certain. One dilemma I see, and I think most researchers realize, is we made so many changes. We intervened at so many levels. We essentially can never prove what worked. So do face masks work? Probably. Do we have any science that say face masks really did it? No. Because we did face masks, social distance, we did disinfection, we did ventilation, all at the same time. But I think it's pretty safe to say some are more likely than others to be successful. And here's something that I'm up against. We're doing some work with Uber and rideshare companies. This is a UV light in an Uber cab. And I asked the person, explain this. He goes, I don't know. I read on the internet. It seems like a good idea. And ultimately, he told me it makes people feel safer. So it's nothing to do with providing safety. It's really just sending the message. I am doing some work with the Broadway League where we're trying to figure out the best way to open up Broadway. Broadway is so complicated because you have the front of the house, you have the back of the house. Some of these are public spaces, some of these are worker spaces. There are 16 unions in the typical Broadway theater, 16 distinct unions that all want to say in whether they can come back. But one of the most important things in Broadway is you need to be 100% full to make money. So there's no way you could social distance on Broadway. Every seat has to practically be filled for the show to continue. That's the reality of theater in New York. And here's one test that I was involved in last week. You see a haze in the air, and this is a chemical that is hopefully will be approved by EPA to be an airborne disinfectant. This is a level that's maintained in the theater such that when you cough, the short distance between two people will give time for the virus to be inactivated with the glycol-based disinfectant. I can't tell you the name, but it's a glycol-based disinfectant, not unlike e-cigarette smoke. So we're hoping that this may help. But is this the only solution? And probably not, because you still would like to wear a mask and you would still like the hand hygiene, and you still, well, some of you would never even come in here because you're just not willing to take that risk. So it's a really complicated calculus. And that we see now with natural ventilation on the streets in New York. Some of these are great. I have no problem eating at these venues, plenty of air movement on an evening or during the day. But now we see some crazy structures. And if you're asking yourself, is that really COVID safe, that space? And the answer is probably not, because they're creating their own outdoor tight spaces in these bubbles. But the regulations are such that it's permissible, and we want some positive movement. We've also seen this report that didn't seem to get much traction, that the survivability of the virus in air, paper, metal products has been sort of studied early on, but people still just don't buy it. They still are worried about opening their mail and cleaning their food and handling plastics. So we do have this sort of crisis in trust and confidence, which of course is starting at all levels of government from the top on down. I do some work with building ventilation systems, and FYI, the 3 Fs, we want a lot of fresh air, we want a lot of air moving through a building, and we would like to also filter that air. This is very nice, it's very theoretical, but can that happen on Broadway? Can that happen in a school? Can that happen at a restaurant, retrofitting these systems? It's gonna be very tough. So what we have in risk is, I tried to sort this out. There are things we want. There are things that we take chances, especially we take chances when there's something desirable, beneficial, maybe economically desirable too. And something like dining and theater and exercise. People want to go to Broadway and they're willing to take that as extra risk. So in one aspect, which of these venues is really amenable to that? Because some aren't, right? Subways. No one rides a subway because they like riding the subway. It's more like a reluctant risk. And of course, we have something in the middle, a voluntary risk. And this is a moving target for all of you. You all have different risk levels and risk tolerances. And the worst thing we could do is say one behavior, one intervention is uniformly applicable to everything. You know that life is not that simple. Compound these categories of risk tolerance with the fact that you have your pod, your immediate people you trust and know. And for me, it's my students every Thursday night because I know they've been tested. That's my pod. Then you have your family, your friends, and of course, strangers. So when you merge these variables into the different venues, it's a complicated calculus. And most people give up. They just say, I'm just going to wear a mask all the time. I'm going to obsessively hand hygiene. I'm going to avoid crowds, and I'm just going to lock down, which is the wrong way to go. You need to assess each of these risks individually. And I'm sort of proud of Cuomo in many ways, but it was very nice to see him out there sending a positive message, being in a subway, doing a show and tell with aerosolizing some disinfectant in the subway. Of course, he's not wearing his mask the right way, but that's okay. So this positive messaging has eluded us. We're getting so many different messages, possibly because of social media, possibly because of the election. There's so much politics between all these states. So it is a very frustrating thing to sort out all these interventions, especially when we don't know which is the absolute best. I do want to say that, and I believe Mike Merson also said this, that vaccines are part of the solution and not the single solution. We're all waiting for it. I can't wait for it, but it's not going to make everything better right away. And it's going to be part of the overall. I just also want to reinforce that when you are assessing a venue, to really ask yourself, what is your risk tolerance and what's the probability, and sort of go through this exercise in your head. Lastly, I said it before and other people have said it, leaders are providing a variety of conflicting, contradictory signals. Some people are discounting certain practices, not visiting cities, writing things off. And this craziness that we're seeing now, especially in this electoral climate, is very frustrating and interfering with good public health, science-based public health.